Hey, good morning. Happy Tuesday, everyone. Welcome to another episode of Tuesday Tea with Mandy B. You guys, it's been quite a ride this week. First of all, I am drinking French chocolate tea, but I mixed in some chocolate chip cake matcha in with my tea this morning because I need all of the extra sustained energy that I can get. We have had quite a ride. If you've been around, you may know that we sold our house. We listed our house. Let me back up before that happens. We listed our house. We got a contract. We moved out into our new apartment where I am right now. But just 36 hours before closing, our buyer terminated the contract. And so in this week, we are in the process of moving everything back to our old house. It's been a little bit of a ride. So hence the extra matcha in my tea this morning, because we will have moved twice in the last 3 weeks and things are just a little bit crazy. We're about to start school. I just turned in my summer school grades yesterday. And so anyway, it's been a little crazy around here, but I didn't want to miss a chance to go live and catch up with all of you as we talk about our Tuesday tea topics. And so today, you guys have heard me talk about my diabetic journey. You know that I am a type 2 diabetic and I wear a continuous glucose monitor. You can see it right there. It's getting a little rough around the edges. This one, I've got a sticker that I can put over them to keep them on a little bit longer, but they last about 10 days. So I track my glucose constantly. It takes readings every 5 minutes and it comes straight to my phone, and I can see what foods make me spike and what makes me, when I go low. And I can tell you without hesitation that the stress of these last 3 weeks has actually affected my blood glucose. We talked about stress a couple of weeks ago, how exercise can help lower stress levels, deep breathing can help, all of that is good. But I've gotten some questions about diabetes itself. What is type 2 diabetes? I've had some people asking those questions, messaging me. And so I just wanted to kind of take a big step back today and just talk a little bit about what type 2 diabetes is. I think it's a really misunderstood condition. And so I just made some notes that I thought we would go over together today to talk about what actually is type 2 diabetes. So it's different from type 1 diabetes, which we'll talk about. And then I'm going to actually extend this into next week's Tuesday tea topic, and we'll talk about ways that we can help control type 2 diabetes. So some of the things that we do, like wear a continuous blood glucose monitor, work with diet and exercise, there's medications, there's all kinds of things. But I think today we'll just kind of take a bird's eye view of what diabetes actually is. So if you're curious to learn more, stick around, and I'm just gonna tell you a few things about type 2 diabetes. So it is actually a chronic condition. There's no cure for type 2 diabetes, but it doesn't have to be a death sentence, right? It doesn't have to be the worst news in the world. It can be controlled with diet and exercise, which we're going to talk about much more next week. I have been able to avoid taking medication or insulin since my diagnosis. Now, I did have to take insulin because I had gestational diabetes with both of my pregnancies. First with my twins, who just turned 17 this weekend, and then with my daughter, who's about to turn 13 in a couple of months. With her, my gestational diabetes was not able to be controlled with diet and exercise, and they did put me on insulin shots. We tried medication, and I had a horrible reaction to that medication. And so one of my personal goals, because of that reaction that I had to the medication, is to never have to go back on that med again. I want to do everything in my power to be able to stay off of that medication. And so that's why I share everything about my diabetic journey here, so that maybe if it's something that you deal with too, you can get some of the tips that we have and be along for the ride with us. But like we said, it is a chronic condition, and it basically just boils down to the fact that your body doesn't make enough insulin, or it doesn't use insulin properly. So you may have heard the term insulin resistance, and that's one of the things that type 2 diabetics deal with. So insulin, what is insulin? That's a hormone that our body uses to help metabolize sugar, or specifically glucose. So glucose is one of the main driving macromolecules. I'm going to try to not to get too biology professory on you, but there are macromolecules that we ingest, right? Like carbohydrates, fats, proteins, lipids. Fats and lipids are the same, but we eat a lot of different parts to our diet. You may have heard those if you look at macro tracking and you're tracking your carbs and your proteins and your fats. All of those are important, but one of the particular carbohydrates is glucose. And our bodies use glucose in every single cell. It's part of our energy process in our cellular respiration process that we use when we create energy. And so when there isn't enough insulin, or when you're not using insulin properly, when your cells can't absorb it properly, it builds up in your blood. And so that's when I see a spike, for example, on my glucose monitor, that my blood glucose is getting high. So after you eat something that's carb heavy, that your body is shifting over to glucose or breaking down into glucose, your blood glucose levels will rise. Over time, this can lead to some pretty important health problems that we need to talk about, which I have a little bit later in our planned topic today. So there are two types of diabetes. Type 1 is a little bit different. We'll talk about the differences between them, but type 2 is the most common form, and it's usually developed in adulthood. So you may have heard it called adult onset diabetes. But it is becoming a lot more common in children and teenagers. The rates of diabetes have risen concurrently with the rates of obesity. And so we see that increasing in our children and teens, obesity rates and diabetes rates as well. It's really a complex disease. There's still a lot of research that's going on to understand all of the interconnected factors that contribute to it. There can be some genetic components, but there's a lot of lifestyle components to it well. So while there's not a cure, we can help control it with some certain lifestyle changes and even some treatments that we have that can help manage diabetes throughout the rest of your life, to hopefully, like me, to be able to stay off of medication. That's my goal. But we do have some things that we can do. So let's look at the difference between type 1 and type 2 diabetes. They share the same name, but they're actually really different diseases. So type 1 diabetes is actually an autoimmune disease where your body is attacking and destroying the cells in your pancreas that produce insulin. And so other autoimmune diseases that you've heard of, right? You may have heard of lupus. There's lots of different types of autoimmune, but type 1 diabetes is classified there as an autoimmune disease. So because of that reaction in their bodies, people with type 1 diabetes have to take insulin injections to control their blood sugar levels. Their bodies don't create enough of it because those cells in their pancreas are being attacked and destroyed. And so we have to supplement insulin into their bodies to be able to kind of clean out the glucose from our bloodstream. On the other hand, when we look at type 2 diabetes, that's a condition that develops when the body becomes resistant to insulin. So when our cells can't take it up properly, and there's receptors on the cells, and all of this can get really complicated, but you're resistant to insulin, or your body's not producing enough of it. So in some cases, like myself, we can control that blood sugar, those rises and falls, with diet and exercise. But sometimes we need to take insulin injections. You may have seen people inject themselves with insulin or wear an insulin pump that can help control that a little bit more automatically than having to measure out and inject yourself all the time. But it is definitely tied in with a sedentary lifestyle. That's one of the environmental factors. But there are some things that we can do, which we'll talk about in next week's topic. So how do you know if you have diabetes? What are some of the symptoms? I get asked this question a lot because I talk a lot about blood sugar friendly. Well, how do you know if you have a blood sugar problem? So there are some symptoms. Sometimes it's really difficult to spot. And I'll tell you that so I had gestational with both pregnancies, and then I was diagnosed about 5 years ago with type 2 diabetes. I didn't have very many of these symptoms. I actually went into the doctor because I was feeling like depression. I thought maybe some of my anxiety issues that I had in grad school were returning. I was thinking it was completely mental health. And when they went in and screened me, I will never forget, you may have heard me tell this story before, but the doctor walked back in to the exam room and she was carrying a blood glucose monitor. And I just knew in that instant that that was what the issue was. And I hadn't tied it together that any of this was tied in with being diabetic. But most of the key symptoms that we talk about, if you have a diabetic condition, you might have increased thirst or frequent urination, fatigue, blurred vision, increased hunger, and slow healing wounds or sores is another one. Now, these are just kind of the classic like textbook symptoms that we talk about. Some people exhibit these and some people don't. And so, if you're experiencing any of those, it doesn't mean you have diabetes, but I would definitely talk to your doctor if you're experiencing any of those types of symptoms. So it doesn't mean that, you've been diagnosed. It just is maybe indicative that something is going on with that blood glucose. There are also some risk factors that can contribute to developing type 2 diabetes. There is a genetic predisposition. If it runs in your family, you might need to really, get that blood glucose checked more frequently. I get my A1C, which is a blood draw that they do. That's kind of average, if you want to think about it that way, of your blood glucose. So when I take my blood glucose, or when it's measured on my monitor, that's like a snapshot of that moment. And that can be determined by what I ate, or how good I slept, or how much my stress level is, how high or low that is. There's a lot of things that could go into that moment of my blood sugar. But an A1C is a number that's measured, it's about a 3-month average of your blood glucose. The numbers don't line up. It's a different scale, but it gives us a better picture over time of how your blood glucose in your body is reacting. So we talked about some of the numbers, I think, a couple of weeks ago, but pretty much anything over a 6 is considered either pre-diabetic or diabetic, 6.0. So you can have that genetic predisposition, but there's some other risk factors that are tied in with type 2 diabetes. One of them is weight. So obesity and being overweight are thought to be the main risk factors for developing type 2 diabetes. And it has been shown time and again that losing excess weight lowers the predisposition, or that pre-diabetic, you can bring it back down to normal levels just by losing a little bit of weight. Even 5% of your body weight can make a huge difference in your blood glucose levels. The second risk factor is inactivity. So we all live a much more sedentary lifestyle than, say, our grandparents did. We drive everywhere. At least in a place here where we live in Texas, we don't have public transportation. We don't walk a whole lot of places. We drive pretty much everywhere we go. I sit at a desk most of my workday. I'm not up and moving around like I was when I was teaching full-time in a K-12 classroom. So I definitely fall into that category of living a more sedentary lifestyle. So physical activity can lead to weight control, which can lead to developing type 2 diabetes as well. Also, activity, when you are moving your body, that is using up glucose from your bloodstream. So your muscles are taking it in to get energy so that you can continue walking or riding your bike, or going up and down the stairs. All of that type of activity is kind of eating up that glucose in your blood. And so that can help reduce that or increase that insulin sensitivity if we're looking at being insulin sensitive as part of that process with type 2 diabetes. Family history is definitely one of the risk factors. If it runs in your family, you may have a greater chance of developing it, but you don't have to be a victim to your genetics. You can definitely still make some of these lifestyle changes with diet and exercise. So eating more whole foods, things that we talk about here on Tea Time with Mandy B and on my Instagram, all of those places. Those are the tips that I'm giving. But you don't have to be a victim to your genetics. And the fourth risk factor that I have here in my notes is age. The older you get, the greater your chance of developing type 2 diabetes. So really over the age of 45, that's what I'm going to turn this year in October. We knew that after my second pregnancy with having gestational diabetes, that I was at a much greater risk. So if you fall into that category, you're in a higher risk of developing type 2 later in life. They checked my A1C every year when I went in for my annual exam. And so most people don't get that checked yearly. But if you are in one of those risk factor categories, you might want to ask your doctor to run an A1C the next time you have blood work done. So type 2 diabetes can lead to some possible complications if it's left untreated. It can actually do a lot of damage to your heart, your kidneys, and your eyes. My optometrist checks certain things every year with my vision because diabetic retinopathy is a real threat. So they definitely keep tabs on that. It can lead to nerve damage and problems with blood circulation. In severe cases, it can actually lead to chronic organ conditions that may require a transplant. But the good news is there are treatments and even simple lifestyle changes that we can make to help control, even though we can't cure diabetes, we can control and keep those complications from occurring. So the key is to get diagnosed as soon as possible, as early as possible if you have any of those symptoms, and start really dealing with your doctor and getting plugged in with a specialist. But it's totally possible to live a long and healthy life despite having type 2 diabetes. So be sure to visit your doctor if you are experiencing any of those symptoms. If you are in this boat and you're working on your insulin sensitivity with me, I'm here for you. That's what we talk about. But there's lots of just healthy choices that we can make that will help whether you have type 2 diabetes or not. So I just wanted to kind of give you that overview of type 2 diabetes. Next week, we're going to talk about some of the ways, some of those lifestyle changes that we can make that can help control type 2 diabetes. But tune in even if you're not a diabetic, because these are great changes that anyone can make that are just good, healthy choices that we can make. So thanks for joining me for another episode of Tuesday Tea with Mandy B. You guys, we're going to be moving like crazy this week. It's going to be a little bit of a weird week, but happy back to school if you're in that category. Happy Tuesday, and I will see all of you right back here next Tuesday. Bye for now.